did you become interested in prevention?
Oh, that's a great question. So I actually started my career as a cardiovascular imager. After I did my cardiology fellowship, I did a 2-year fellowship in cardiac CT and MRI. And I was recruited to my first faculty position as a cardiovascular imager to start an advanced program. And as you know, a lot of what we do, particularly with cardiac CT, is atherosclerosis imaging. And so I think a lot of the people who you see in prevention today actually had their origins, at least to some extent, with cardiac CT, because when you're looking at plaque day after day, you naturally get interested in the underpinnings and understanding lipids, atherosclerosis, prevention of cardiovascular disease. And that's actually what happened to me. So as my interests were evolving from a pure imager into actual clinical prevention, it just so happened that a very important mentor entered the scene who was a preventive cardiologist, and I sort of went hook, line, and sinker towards the prevention side. Yeah.
I love everything you just mentioned, and that's actually kind of how I got interested in prevention. So whenever we do intravascular imaging, even if the angiogram looks like you had one focal lesion, there's always soft plaque. And then you start to wonder which plaque is vulnerable, and it's hard to ignore when you can see the picture. And I think the thing you mentioned about finding the right mentor at the right time, it just happens that way.
Yes.
So I love that ASPC is bringing together these wonderful minds in prevention, because you're giving people an opportunity to see like this is actually a pathway that exists.
Absolutely.
Awesome. Well, what message do you hope every attendee walks away with this year?
Yeah, I think the main theme is that, in the past, even though there were always individuals interested in preventive cardiology, I think many cardiologists, in fact, many internists and family docs would say, well, I can prescribe that same atorvastatin that you can. What actually makes you different? And I think what we're seeing now is a proliferation, an explosion of new therapeutics, not just in lipids and hypertension, antithrombotics, anti-inflammatories, diabetes drugs that are really cardiovascular drugs, and major advances in diagnostics and risk assessment tools, right? So now coronary artery calcium is mainstream. We're looking at how could you use coronary CT angiography to maybe detect disease in asymptomatic individuals, how you can track disease, obviously the advent of polygenic risk scores. So we have a lot more tools at our disposal for risk assessment and for treatment. And it's a renaissance in preventive cardiology. And I think a lot of attendees who are here for the first time and are being exposed to this are really, getting very enthusiastic about what we can provide to patients and how we might be able to prevent cardiovascular disease.
For any fellows listening, I wish I had this kind of opportunity when I was in fellowship, because this is incredible.
I'm glad you brought up that point, because for the first time we offered a ASPC training academy, which was a 1-day, really intense exposure to the fundamentals of preventive cardiology. Because I've come to the conclusion in recent years that we all know most training programs do not give a formal exposure to preventive cardiology. And I think most fellows who come to cardiology are coming because they've been exposed to either the cath lab, the EP lab, heart failure, imaging, and that's why they're in cardiology. And they haven't had an exposure to prevention, so it's almost too late to get them interested by the time they're fellows. So we're now trying to engage also residents. You can't get interested in something you're never exposed to. So we brought in residents and early fellows to this 1-day intensive. It was a great success, so we're already planning for next year as well.
That's amazing. Could we possibly do a mini boot camp for interventionalists as well?
Okay.
I would love to see a collaboration with Sky, for instance.
Perfect. Let's do it.
So what's been the coolest thing you've seen or learned at ASPC this year?
Oh, that's a really tough one, because I think David Marin, who is the Congress Planning Chair, has put together a terrific meeting. I really love debates, and we always have debates, but this year Dr. Marin had a session on debates yesterday and today. And so I think that's been really informative, and I think that a lot of the attendees have really enjoyed it. So we had themes about ApoB versus LDL cholesterol. Should we be using colchicine in secondary prevention or not? Should we use CCTA as a disease tracking tool? Some really hot topics, and I think everybody's really learned quite a bit from it.
I think it's brilliant to also share all these perspectives and show people that we're still answering a lot of questions. And so we're in this discovery phase.
Right.
And so what has been the biggest shift in the last year in prevention?
That's an interesting one. I feel that there's obviously a lot of momentum, a lot of interest in lipoprotein(a). If I gave a talk about lipoprotein(a) even 3 or 4 years ago, And I, at the beginning of our talk, asked for people to raise their hands if they've ever heard of Lp(a) or if they've ever tested for Lp(a). Very few hands would be going up. Now it's becoming increasingly recognized as a likely causal factor in atherosclerotic cardiovascular disease and, in fact, aortic stenosis. And we're starting to see some familiarity. We're starting to see somewhat of an increase in testing. And this is largely due to the fact, as you know, there's some very promising Lp(a) lowering therapeutics in late stage development. And in fact, we are poised to see the results of the first cardiovascular outcome trial with one of these Lp(a) lowering drugs in 2026. So we're all very excited about that because this is the most common inherited dyslipidemia. About 20% of the population has an elevated Lp(a), but we say it's hiding in plain sight because it's not universally screened for.
So my next question is, who should we be testing for lipoprotein(a)?
I would say at this point, the consensus is moving towards actually universal screening of all adults, one time at least in their lifetime. The European Atherosclerosis Society and the European Society of Cardiology were sort of the pioneers in sort of suggesting universal screening. So they actually put in their guidelines in 2019. A couple of years later, the Canadian Cardiovascular Society made a recommendation for universal Lp(a) screening. This year, the National Lipid Association. As you know, we're expecting the ASPC cholesterol guideline probably next year, so it'll be interesting to see if they make that move as well. But really, that's where the field is going because it's such a common inherited risk factor.
I also heard that they're doing some lipoprotein(a) testing here, and I don't know my level, so I'm going to go get checked out.
You definitely should do that. And in fact, it's actually a 3-for-1 because they're also checking with the same, it's not even a needle stick, it's sort of like what you get with the CGM, that little prick that you do in your arm, a lipoprotein(a), a CRP, and an LDL cholesterol.
Wow.
You get them all.
Amazing.
Yes.
Here at ASPC. My last question for you is this. The biggest myth about cardiovascular prevention, what is it?
That it's not real.
That it's not real. What is the biggest myth in cardiovascular prevention?
That's the myth, that preventive cardiology is not a real subspecialty of cardiovascular medicine. And I'm here to tell you that it has arrived and that because of the developments in the science and the risk assessment tools, the therapeutics, there are now so many tools that we have to identify and treat disease in a very early stage and hopefully keep people with a healthy heart.
I think the work that you do is incredibly valuable, and I'm so happy to see this organized body now sharing information with the larger cardiology community because it's impossible to keep up without something like ASPC. So thank you for doing that.
Thank you so much.
And what do you do for fun? I know that was supposed to be my last question, but what do you like to do for fun?
I love scuba diving and love to read. I love history. I love to go hiking with my family. Yeah,
Awesome.
tennis.
All right. Well, thank you so much for your time.
Thank you.